Good day, everyone. I'm Dr. Philip Tan-Gatue. Once again, I'm here to talk a bit about Chinese medicine and help spread the gospel a little bit, so to speak. Thank you very much for watching my videos, leaving your comments. I try to answer each and every comment that I see. I mean, I try. Sometimes I can't. My apologies if I don't. But do leave a comment, do hit the like button, and do hit subscribe for more traditional Chinese medicine and acupuncture content. So today, I would like to deal with a question that was presented to me because of my talks on Lianhua. Lianhua Qingwen, as I've said, deals with, in particular, in my explanations about aversion to cold. Okay, so why do I have to distinguish between aversion to cold and chills? Well, to answer that will take a series of videos, and so for this one, I'd like to go with the eight principles of diagnosis. Okay, so the eight principles of diagnosis are like a guide. So every Chinese medicine practitioner looks at disease in light of these eight principles. These eight principles are actually four pairs of opposite characteristics. These are yin and yang, cold and hot, deficiency and excess, and interior exterior. The reason why aversion to cold is a big deal is because it tells us that the disease is still not in the interior. Because if it's actual chills, that tells us more that the problem is in the interior. So you notice no matter how many jackets you put on, you still feel cold because the problem's inside. But if the problem's in the exterior, then reducing the pathogen that triggers it can help alleviate the symptom. First of all, yin and yang. Every disease in Chinese medicine is considered to be ultimately an imbalance between yin and yang. There's too much of one, too little of another, or combinations of both. So, what are yin and yang? We could go on a separate video for that, but for the purposes of diagnostics and for the purposes of teaching laymen about it, my preferred definition is the yang refers to the physiology, how the things that make the processes work, while the yin is the anatomy, the physical structure of the body. Obviously, you can't have one without the other. In another way of looking at it, the other three pairs of characteristics can be classified into yin or yang. So, yin would be the cold, the deficient, and the interior, while yang would be the exterior, the warmth or heat, and the excess. So let's try to just give a few classic examples from Western medicine to try to explain those three pairs. Deficiency versus excess. Too much of something, too little of something. Okay, so let's look at pain. Everyone's had muscle pain. And if you have muscle pain now, try pressing on it, like a little bit, massaging it. Does it hurt more or does the pain feel relieved? If it hurts more, it's most likely an excess, probably a new injury, so it's still swollen. All the blood and other inflammatory cytokines have rushed there. And so putting more force into it draws more blood into it, draws more chi into it. So if it's an excess and then you add more stuff to an excess, it gets worse. If it's a chronic pain, it's more likely a deficiency. There's an injury to the flow of chi and blood, and thus the chi and blood in that area is deficient. By pressing on it and massaging, putting force into it, you're adding more chi and blood into it because you notice when you press it becomes red. So that's because more blood flows into it. In fact, if you look at many of the modalities of physical therapy for pain, you see a lot of heating modalities: ultrasound, paraffin, and a lot. Why? Because you want more blood flow to that area. It's deficiency pain. Hot and cold. The easiest way to explain heat is to use the equivalent word in Western medicine, inflammation. What's the root word of the word inflammation if not flame? So anything that's heaty is inflammation. And conversely, anything that's crampy or cold is cold, obviously. Why is this important? Because there are some herbs that promote warmth. If the patient already has inflammation and you give something that promotes more inflammation, it gets worse. At the same time, you have to diagnose it as heat, so you give the appropriate cold medicinal. Lianhua, for example, is meant for symptoms of heat, not for cold. If the disease is cold, however, that will usually manifest as slowing down of digestion. So, uh, food that remains stuck there, it's not digesting properly, blood that's not flowing properly, chi that's just stagnating here and there. That can be due to cold. In fact, the muscle pain can be due to cold. That's why you apply heat. Finally, interior exterior. Lianhua, for example, is more for exterior disease, but with a little bit of interior lung heat. But it's not totally interior. So, how do I explain interior and exterior? Um, an interior disease usually is referring to the internal organs. So, while an exterior disease is the disease is confined, as for now, in the patient's skin, muscles, fascia, connective tissue. If you look at the house, for example, the outer gate and the space and the garden in between the gate and the main door, that would be the exterior. So if the bad guys are there, the symptoms would be relatively mild. So exterior disease, you'd have a particular pulse, you'd have a particular tongue color. Again, going through this would take too long for the purposes of this video. But remember, I said muscles. So flu-like symptoms, they start with muscle aches and pains. Oh man. If there's a fever, it's usually not so high, not so hot because it's still in the outside. Whereas if the disease is in the inside, then you have an actual fire causing the fever. That's why the symptoms are worse, the fever is higher. Again, this is essential because there are herbs which clear the exterior and there are herbs which work in the interior. Usually, formulas like Lianhua will have a mixture of both. But the point is, this is how we look at disease. So, this is also why we can't just take what works for one person and assume that it will work on the next guy. No, each patient, we have to try to look at it from those eight principles, come up with the appropriate treatment, and let Chinese medicine work its magic. Well, thank you very much. I hope that that very, very brief introduction to the eight principles of diagnosis would help us understand what we're doing in Chinese medicine. Thank you. Keep well, keep safe.